Thank you very much, Leah. And thank you to Rena. I never take the opportunity to take a few deep breaths throughout the day. So this is great. I feel refreshed. So welcome to everybody to the panel on opportunities for growth of value-based healthcare across Canada. This panel session is intended to draw on the earlier conversations and presentations we heard today to explore the opportunities for value-based models and for value-based initiatives across Canada. As we all heard, the implementation of value-based models of care hinge on data, patient data, care outcomes data, and cost data. However, the context within which the data come from and within which they exist needs to also be considered. And specifically, factors that are outside of the health system that influence health need to be addressed. Relatedly, silos need to be dismantled within healthcare, and we talk about this a lot, but also between sectors and between ministries. This also speaks to a shift from sick care to healthcare, and importantly, the need to recognize the influence of social determinants of health in value-based solutions. As on the first day of the summit, Kwame Mackenzie emphasized in very, very practical terms, the fact that innovations will increase disparities if we don't design them not to at the outset, at the very beginning. So the importance of co-design in engineering solutions for improving outcomes for all population segments, including those who face barriers, or maybe mainly those who face barriers due to poor determinants of health, cannot be understated. Digital equity, for example, is now a component of health equity, and this needs to be considered when assessing the value of innovations in healthcare as well. To this end, advancement of value-based healthcare needs to be co-driven by patients and by caregivers with diverse and relevant lived experiences. Our panelists, who I will introduce momentarily, will provide insights into opportunities for advancing value-based approaches to care with a view on data sharing, measurement of patient-reported outcome measures, equitable access to innovations, and integrated models of care. These are all concepts that we just heard about earlier today. Based on their expertise and wealth of experience, they will speak to some of the strategic opportunities in Canada for growth of these value-based initiatives, as well as the role of social determinants of health in the implementation of value-based health solutions. So with that, it is my pleasure to introduce our panelists. I will start with Kristine Neglia, who is the manager of OCAP and Information Governance at the First Nations Information Governance Center. Then we have Maria Santos, who is First Nations Data Center Manager at the First Nations Information Governance Center. Then it's my pleasure to introduce Paul Larchevêque, who is the Innovation Director at the Quebec Ministry of Health and Social Services. Paul, I said that in English as opposed to using my accented French. and finally, we're delighted to have Rodney Burns, who is the Chief Information Officer at the Alliance for Healthier Communities, with us. And so I welcome you all, and maybe if Kristine, if you would like to start by addressing, both, and then we'll take turns. We have about 25 minutes or so to address the questions of strategic opportunities for growth of value-based healthcare initiatives, as well as the role of social determinants of health. So maybe if we start with you, Kristine, then we can move to Maria, Paul, and Rodney, and then depending on how much time we have remaining, we can have an open conversation as well. And it is intended to be an interactive session, so by all means, don't feel too confined by the time. Kristine, you might be on mute. Ah, there you are.
All right, I've passed the first test. Thank you. Good afternoon, everybody. My name is Kristine Neglia. I am a member of the Curve Lake First Nation in Ontario, born and raised in Toronto. I'm speaking to you today from Ottawa, from the unceded territory of the Algonquin people. And when I do my land acknowledgement, in my acknowledgement, I'm also acknowledging not just the land, but I'm acknowledging the laws, the languages, the values and customs and songs and ceremonies of the Algonquin people that still exist to this day. Today I'm going to talk a little bit about the principles of OCAP, and why I'm here is in the Declaration of Personal Health, Data Rights and Obligation in Canada, OCAP is mentioned. And I wanted to talk a little bit about the principles so that everybody has a clear understanding of what they are and how they can be, how they could support the declaration. So first I'll talk briefly about what the principles are. The First Nation principles of OCAP establish how First Nations data and information will be collected, how it will be protected and shared. When I talk about the First Nations principles of data, it's really important that I'm specifically talking about First Nations. I'm not talking about Inuit, and I'm not talking about the Métis. Each of these groups have their own articulation of how data should be collected and used. And this articulation is in line with their worldview and with their customs and values that are different from First Nations. So when I talk about OCAP, I'm talking about a very specific First Nations principle. Standing for ownership, control, access, and possession, OCAP is a tool that can be used by First Nations as they move down the path towards First Nations data sovereignty. It's a strong information governance tool that really looks at how information should be collected, gathered, used, disseminated, destroyed if need be. And it's in line again with the First Nation protocols. The first principle is ownership. Ownership refers to the relationship that a First Nation has to its First Nations data. And this is different. Just as individuals have a relationship of ownership over their personal data, First Nations are asserting ownership over collective data. So when I say, when I talk about First Nations data, it's data that is about First Nations, right? Health, housing, child welfare, education. It's also it's data that's about our lands. So our lands, our waters, our resources. And it's also data that comes from us. And that's our language and our songs and our ceremonies. So the definition of First Nations data is pretty big. And it's holistic, and it reflects our understanding of data. So ownership refers to First Nations at a community level have a collective ownership of their data. Where we run into problems is that community level data is not recognized by major federal legislation. It's not recognized by the Privacy Act. It's not recognized by the Access to Information Act, and it's not recognized by the Library and Archives Act of Canada. And where this is problematic is that it specifically exposes both First Nations data to vulnerabilities such as ATIP, but it also way down the line, like after a certain number of years, it could also expose individual First Nations people with their identifiers in ways that no other Canadian is exposed. So looking to get recognition of ownership at a community level is one of the assertions of First Nations. Another, the OCAP also asserts that the intentions and inherent rights of First Nations to regain and maintain control over all aspects of their lives. That includes people, it includes lands, institutions. This inherent right and this maintaining and regaining control also extends to our data and to our information, because our data and our information is a resource. So control, the principle of control affirms that First Nations, their communities, their representative bodies are within their rights to seek control over all aspects of research, of data, of information management that impacts them. The principle of control asserts that First Nations people, the representative bodies must control this. They must have more than just a stakeholder role in how these pieces or processes are rolled out. When we look at the principle of access, this is a two-pronged principle. This principle first asserts that First Nations must have access to information and data about themselves. They must have access, of where data is held. Of where data is held, regardless, whether it's at universities, whether it's governments. And the other part of the access as well is that First Nations should also be able to control who else has access to their data. not just who has access, but who else doesn't have access. And this is really important when we think about all the different types of institutions and organizations that access First Nations data without the benefit to nations themselves. The fourth principle is the principle of possession. I'm so sorry. It's not my phone, it's actually just my timer. So the fourth principle of possession is that literal principle. So to fully be able to assert ownership, control, and access, the best way to do it is to physically possess the data that you have. Possession is the literal mechanism, the actual mechanism that First Nations can use to assert the four principles. We know that there's not a lot of funding for nations to be able to build data servers and networks in their First Nations. So the alternative to, a viable alternative to possession is stewardship. So building those relationships with a third party who they will act as stewards and manage the data, but the ownership, the control, and the access all still remains with the First Nations themselves. How much time do I have left?
So everything you're saying is so ever important, but if you don't mind, we'll move on to the next presenter just so that everybody has an opportunity to present, if that's okay. Unless you have you'd like to conclude with. Yes.
When we talk about the principles of OCAP, one of the key pieces is about organizations making space for OCAP and making space for First Nations to articulate what OCAP looks for them. And I think there's a really important opportunity within the declaration to be able to hear that voice and to find out what that is. Miigwech.
Thank you very much. And we appreciate you setting your alarm to do that. Maria, would you like to follow up on that, please?
Hello. My name is Maria Santos, and I am the First Nations Data Center Manager at FNIGC. And Kristine did a great job describing OCAP and First Nations data sovereignty. And so I'm going to take a little bit of a different approach and talk more about the social determinants of health and relate that to integrated models of care and the patient-reported outcomes measures. And so as some of you may be aware that Indigenous people, they tend to view health in a balanced and holistic way with the connections to spiritual, emotional, mental, and physical dimensions. And so, the models of care need to reflect that. And it's not surprising that within Scott's presentation that you can see examples of integrated models of care from the community health centers that are within Indigenous settings. One of the things that First Nations encounter, there is a fragmented system. And so you don't necessarily just also have to deal with the sectoral silos, but First Nations have to encounter the jurisdictional barriers in terms of getting the services they need when they need it. And whether it's being funded by the provincial authority, health authority, or the federal health authority. And so we have tools such, principles such as the Jordan's principle, which was created to address some of these barriers for First Nations children. But even with regards to data, with regards to COVID data, trying to look at that national picture of what does COVID look like amongst First Nations. The data is housed in so many different places that we cannot get a full sense of what the impacts of COVID has been for First Nations. So with regards to, I guess, opportunities, I've seen examples where organizations have taken a holistic perspective. So it's not just the comprehensiveness of the services that are provided, such as primary care and the supportive services as well, but it should incorporate this holistic perspective from the bottom up. So it being within their policies, within the mandate, the vision, the goal of the organization, in the leadership, in the staff. You need to develop those right partnerships and the relationships. So, and with patients being at the center, so that you can make sure that clients are empowered to be able to be engaged. So when talking about the social, I'm kind of jumping around because I kind of just separated it between the two components there. So with the social determinants of health, the thing to realize, you know, with the determinants of Indigenous health, we've talked about, there's talk about the proximal, the intermediate, and the structural determinants of health. And one of the ones that tends to get neglected is the structural determinants of health. And those are the historical, the political, the ideological, and economic and social foundations. So those need to be considered. And in order to make, to be able to address the health inequalities, we need to change those underlying structural determinants, and rather than just addressing the symptomatic effects. So when doing that, one of the examples I see in relationship to data is in order to be collecting information with First Nations identifiers, it's difficult. You see you have a conundrum here where, because of the structural racism that exists, First Nations may not necessarily want to self-identify. So so this is why I'm saying, until you can address those structural determinants, then you're probably going to be able to get better data. And what was one of the other, the other thing that I wanted to mention was to also include a strength-based perspective. So a lot of the times with regards to patient reporting outcomes, we want to be able to measure those inequalities, but we also have to be careful that we're not creating more creating those stereotypes. So we also need to consider strength-based indicators. And those can be anything like Kristine had mentioned, the connection to land, relationships, and communities. And so it comes back to, again, that it's a very holistic perspective when developing these indicators. And I think that's pretty much all I wanted to touch upon. It wasn't very weaved in too well, but listening to the presentations today, they were excellent presentations, and I was just trying to point out some of the things that highlight some of the things that were mentioned.
No, that was excellent. Thank you, Andrea. That was very well presented, and it does absolutely tie into the previous discussion. So thank you very much. And Paul, I will turn it over to you, please.
Good afternoon, everyone. My name is Paul Larchevêque. I'm the head of innovation at the Ministry of Health of the Quebec government. I'll be commenting maybe with a bit of a different angle, and I'll be arriving at the issue from the huge challenges we are faced with in our healthcare system and delivering value to patients, and all patients, that is, which is becoming and will continue to be a tremendous challenge. The issue won't go away, and we need to start addressing that. The reason I'm starting there is because the Innovation Office was created in Quebec with this in mind, of saying we need to integrate more innovation. When we're talking about innovation, we're talking about social innovation, organizational innovation, and also technological innovation. So we've got this perspective which reunite all the three of those type of innovation. And when we were faced with the challenge of saying, how do we go about accelerating the introduction of innovation and the adoption of innovation, the only way forward was, how do we create value through the introduction of innovation? If we're not able to introduce value and demonstrate value, it's going to be very hard to challenge people out of their current position, to create the learning system we need to create, and to get all the people and all the patients involved. So we went with this basis, and with this basis in mind, we've started to use the integrated care concept and that you've been referring to all along this afternoon. And this integrated care concept, initially was integrated episodes of cares, and slowly is becoming integrated health for patients, or for the population, I should say. So that's where the social determinants of health are coming in, because if you really want to act on the ultimate outcome of creating a better care for the population, you need to work on the social determinants. Your integrated perspective is not what's happening at the hospital, what's happening with the patient, it's what's happening with your life and your life habits and whatnot. So we have been using this as the basis for which we would be looking at the value of project and trying to demonstrate the value of innovation that were proposed to us. The other thing we did is we said it's fine to look at an innovation at its face value, but we need also to understand what it does in terms of providing a solution for the problems we've got. And so the way we've developed this kind of equation that we're using, we're having a lot of fun with it. And this equation is saying is that to determine the value of innovation, the first thing you need to take in consideration is the value that it delivers to the patient. And this value needs to be defined by the patients and with the patients, and make sure that we are integrating this perspective and understanding that. We've got tremendous initiatives in Quebec with the partner-patient concept. And I don't know how it translates directly, but it's patients getting involved, very much involved in their management of their own disease. We've got projects on the go, and Eva that was speaking earlier is involved with the proms and how to implement projects that will help us become better and put that to practice and make sure we're using that. So all this patient aspect is the first part of this equation. But the other thing we're asking projects to talk to us about is, if we were to introduce your innovation, if we were to take in consideration what you're proposing to us, would it help us with our access problems? We've got access issues at first line access to physician and nurses. We've got access at emergency. We've got access issue at surgery, and so on and so forth. So how can you explain to me how this innovation is going to help us with this access issue? How it will help us with the problem we've got with not enough human resources being able to deliver all the healthcare we want to deliver. And finally, how is it going to help us solve the cost and efficiencies issue? So we're putting the bar a little bit higher with innovation, but at the same time, the argument behind that is saying, if we're able to build this value, if we're able to demonstrate this value, it becomes very, very tough to resist to it. It almost, you cannot argue against it. You've got a patient which is having access to better treatment as defined by himself. We've got the access issues, we've got the human resources issue, and we've got the cost and efficiency issue. So in a nutshell, this is what we're trying to do to help create a value system which is based on value, by trying to measure. And to do those measures, one of the things we need, and I'm sure Rod will be speaking much more about that, is we need, what's data? Is that what we need? Yes, we need lots of data. I'll finish here. Thank you.
Thank you very much, Paul. And over to you, Rodney.
Good afternoon, everyone. I'm Rodney Burns, the Chief Information Officer at the Alliance for Healthier Communities. It's an association of 110 community health centers, Aboriginal health access centers, nurse practitioner-led clinics, and some community-governed family health teams. And so we're an association, and I provide support and leadership around data and technology and systems to help capture the evidence to inform decision-making to improve outcomes at the end of the day. So for me, I am a Irish-Scottish descendant. I live just north of Lake Simcoe, and this land that I live on is enjoyed and has been historical lands of the Chippewas and the Rama First Nation here just east of the city of Aurelia. And I really do appreciate being able to speak to you today. I think the presentations have been fantastic. For me, as you can see, I'm a little bit gray. I've been learning a lot about history and the frailty of my own life as I age. And as a father, my greatest gift is as a parent is to really impart independence to my children. And that means they're educated, that they are aware what they can and can't do. So I have 3 young adult children, and I'm very proud that they are starting their lives off on the right foot. That said, I think as we look at healthcare and value-based healthcare methodologies, a lot of these pieces, I'll call them facets of a diamond. They need to come together to create the brilliance, and we've got to keep our eye on that ball. My partner is a teacher. So to Paul's point, this is not just about healthcare. How do we think about the journey of a person through all facets of their life, from the day they're born to the day they die and thereafter, to inform health and well-being of those that move forward? We need to have responsible use and data that will allow thought leaders, policymakers, providers, and the individual to be informed about what that means. What is the sense making in all of that data that's becoming available digitally as we go forward? It's not going to become any less. But many of our member organizations have been telling us at the Alliance that there's a huge need to be thinking holistically about an individual. So many of our organizations will do harm reduction approaches to services. This is not about cure, right? One size does not fit all. So how do you measure where you're reducing the burden of illness on an individual, but maybe not really healing them per se? If that's what that individual wants in their life, we need to learn how to respect that. The business side needs to find ways to measure that and incent that at the end of the day. So for me, this is about a massive transformational power shift. We give away the power, which means we help to educate those that we're serving and using information in a way that they can understand. It doesn't have to be, you don't need a PhD in epidemiology to figure this stuff out. The technology's there to say red, green, or yellow. You're on the right path. You're headed towards the goals that you've identified. That is powerful. And if we can help individuals think about their own life journey, wherever they're at in it, and think about how to move forward in a way that fits with their circumstances, that's the power of what we're trying to do when I think about value-based healthcare. So all of my comments means we're taking a holistic view of the determinants of health here, right? It's not about, our practice is about slicing things down to the most homogeneous micro element, but putting them all back together into a single story, a single piece, much harder to do, right, at the end of the day. But that's where we've got to think collectively about how do we get there to actually say to an individual, we can see progress, you're on the right track. And that voice is critical to say, I want to go in that direction. It's not about, and when I started my career 30 years ago, I used to read charts and do chart audits, and I'd see patient is non-compliant, meaning my clinical advice was not followed, and therefore this person deserves the morbidity that they're suffering with. That has totally been turned around, but it's the insights and having your eyes open to say, this is where this client wants to be right now. How do we reach out to where they're at? So to that regard, we've heard some questions about digital equity. A lot of my time is about removing barriers to digital participation. We're going to be moving forward. So how do I think about my children being able to participate at, in a digital society that is just? So a lot of what we do is about social justice, health equity, including digitally accessible services for everyone that lives, at least in the province of Ontario. Even today, I was on a national discussion looking at how do we uniquely identify everybody digitally? That's just the starting point of this story, let alone how you control, as Kristine said with the OCAP principles, how do we think about access, control, and possession of that information by whom, and how is it done in a way that government and the big agencies and private sector are transparent with how they're using that information? Is it in my best interest to share my information? So I think this is not an end state by any means. We've got a lot of work to do, but there's some really great work going on internationally in this regard. And I think Canada's started down the right path, looking at how do we actually move some of these narratives forward and on the ground make it happen. So when COVID hit, we were fortunate to be able to go to TELUS Health, and they gave us 600 smartphones and prepaid SIM cards that were issued to our clients who are members of the consumption treatment services. They have opioid addictions. They need daily service. But with COVID hitting, a lot of the organizations shut down. So these phones gave them an opportunity to call in, coordinate services, and continue getting their services in a safe way. At the end of the day, the most powerful story that came back to me was a 45-year-old gentleman, homeless, got one of these phones, and it was South Riverdale Community Health Center that had this experience. The first thing that individual did was call his mother that he hadn't talked to in 2 years. That is well-being. That is removing a barrier. That is health. So, you know, we're just very pleased that even the United Way in the Greater Toronto area has provided the Alliance with a grant for an additional $20,000 for more devices. So we're going to continue to try to close device and internet service access barriers. But the biggest challenge will be digital literacy. Do people know how to use these tools and the data that comes across them in a way that's meaningful for them? So that's the kind of comments I would have from the messaging that we've and the presentations we've seen today. I've been really impressed and always am motivated coming to this conference. So thank you for inviting me to share a few words.
Thank you very much, Rodney. That was excellent. Thank you to you all. Leah, I see you've come on. I'm not sure time-wise whether we have a chance to look at some of the questions or not so much.
I am anxious to have us go into breakouts. I know that it is unfortunate that we are cutting short. I'm so glad that we were able to hear the perspectives of all of you, Rodney, Paul, Maria, Kristine. I'm scribbling notes furiously as you were speaking, and it's been really helpful how you've reflected back on what we've been hearing and expanded out from the work that you're doing on different pieces of it. And I think a lot of light bulbs certainly going off for myself. So I don't want people to lose the opportunity to now go into breakouts and have some deeper dive conversations with each other about all of this incredible, these ideas and this information that they've been listening to for the last 2 hours and 13 minutes at this point. So unfortunately, we do probably have to wrap the panel at this point. For those of you who are facilitators in breakouts,